All right. Welcome to On the Sideline. I'm your host, Jeff Holden. Today we're here with another United Regional special guest for our commitment to United Regional and their sponsorship for our podcast, which we appreciate so much. We do have Big O.
How y'all doing today?
And coming from United Regional is Dr. Brandon Ohman. He's our special guest.
How y'all doing? Thanks for having me.
They're cheering for you, Doc.
All right. I'll take it.
Before Jeff gets talking, have anybody ever nicknamed you Dr. O?
I hear it all the time.
Okay, well, I'm Big O. You're
There
Dr.
you go.
O, so Jeff, I guess you don't
like
have
it.
an O.
Just don't call me late for dinner.
We'll do another one of those. All right. So, again, Dr. Brandon Ohman from United Regional, he's an orthopedic sports medicine doctor, specializing in non-operative orthopedics, correct?
That's right.
All right. So, before we get started, I guess maybe just give us a complete rundown of who Dr. Ohman is, where he comes from, how to get here, and all that good fun stuff.
Sure. Yeah, I was born in actually Selma, Alabama, and my dad was in the Air Force, and they were from Texas, but being out in the service, that's where I was born, and so roll tide.
Oh, one of those.
Yeah, sorry.
Oh, man.
Sorry.
It's all
This
good.
off backwards.
When
Hey,
you-
at least you're born there, not like a lot of these fake.
They put it on your birth certificate, either War Eagle or Roll Tide. So.
Okay.
But yeah, I was out there and did most of my raising in Texas, though, and went to Port Neches Groves High School in Port Neches, Texas, and Port Neches Groves, state champions, by the way, last year, beat South Oak Cliff. That's right.
They did. I was just about to say that.
That's my people. Yeah, played there. I played football there for the Port Neches Groves Indians, and went to Cisco Junior College to play football there. And so, athletics was in my blood for a long time. I was gonna actually had a few injuries, and was gonna go for physical therapy in college, and got in a car wreck during college, and went to a chiropractor, and had really good success. Got interested in it, and went to chiropractic school in 1998. Man, that was forever ago, wasn't it? And met my wife
Just
there.
the other day.
Yeah, met my wife there, and we practiced for about 5 years, and went back to school. Went to medical school in the Caribbean, actually.
Oh, wow.
At Ross University in Dominica. I was 31 years old and had 2 kids, and didn't want to wait around to see if a U.S. school would take me, and here we went. And yeah, got through residency at Texas Tech in Odessa, Texas, and did my fellowship at John Peter Smith at the Sports Medicine Fellowship there, and worked with the TCU athletes there in Fort Worth, and we've been at United Regional since. I did have a little stint where I went back to East Texas for 6 months, but we don't talk about that. So, yeah,
Okay.
and came back to United Regional, and love it. Love what we do.
What years were you at TCU?
It was in 2015 to 16. It was for that year. Trayvon Boykin was the quarterback at that time.
Okay, so you were there when Coach Patterson was still.
Oh yeah,
Coach Patterson. Yeah.
Big Pat.
Yeah, good guy.
He could motivate you quickly.
Oh, real quick.
That's pretty cool.
Yeah.
So you mentioned you played college football. What position did you play?
Yeah, I was free safety. Played quarterback and free safety in high school. Just played free safety there, and tremendous athletes in JUCO, in all the athletics, but certainly football. I was telling you earlier, defensive linemen keeping up with free safety and sprints. That tells you something,
Oh yeah, those big guys, man. Just because they're big, it is crazy. I see that. You see that all the time when these defensive linemen go to, the
Combine.
The combine. They're
No.
just just as fast as some of those wide receivers or, tight ends, and it's like running backs. Like, holy cow, how does that happen?
It's just body types. I guess if you're born to be fast, you're born to be fast. And this nowadays,
I was born to be slow.
It's technique. It's a lot of technique to it too. So it's always a lot of guys put a lot of training and things into those things and learn how the muscles fire. And once I guess it's kind of an art to it. So and when you find big guys that's running that fast, I call them freak of nature.
Oh, absolutely.
Yeah.
I mean, that makes you want to believe in the Nephilim that are still here from biblical times.
Yes, sir.
The first time I was at TCU and I saw all the football players in their uniforms, I walked in probably where I wasn't supposed to be, and I thought, my goodness, I was going to play this game? Lord, no. But, no, talent can only get you so far. It's really the work you got to put in.
For sure. Well said. So I like how you have a sports background. I think most of the guys that we've interviewed from United Regional have had that sports background, which is pretty cool. Let's just talk right about what you do, what you see throughout the day. You said non-operative, so I'm assuming a lot of that stuff that you do is in clinic or in the hospital itself. What are some of the most common injuries that you see from a football standpoint?
Yeah, certainly football, you think about knees and ACLs, and you think about shoulders, dislocations, those kind of things. Concussion, thank goodness it's easing up with football. Some of the rules and some of the ways we teach tackling is I think is making a big impact on that. I think those would be the main things that I see. Yeah.
So for a concussion, what would be the protocol for you? They come in, is that something? So I guess my question, let's rewind a little bit. So we had Dr. Dozier on here, and he was explaining about like the Orthopedic Express. Are you one of the doctors that switch in and out with those guys that, could see just whatever comes in the door, I guess? Or
I see by appointment only. The Express is really there for, really acute injuries that give people access quickly, because it's hard to keep enough space on your clinic day to be able to take all of the ones that need to get in. So I'm really proud of our team to be able to make that Express orthopedic available, because it's hugely needed in the community.
Yeah, for sure.
Yeah.
So what would be? I guess everybody has a specialty. So what would be your specialty?
So I do interventional pain as well as sports medicine. So I went to John Peter Smith. They had a pain fellowship attached to it originally, and you did your first year of sports medicine, and then you did your second year in interventional pain. And interventional pain just means we try to do injections or procedures to help with. It can be acute pain, but often it is a chronic pain, injuries to arthritis and disc bulge in your back or pinched nerves here or there. Procedures under ultrasound where we try to free up nerves. Joint injections, certainly. Ablations where we burn the nerves away. Certainly those aren't, your 18, 17-year-old kids that often have those things. But I've had some, and a lot of times spinal injuries will come to me also from different athletics. Yeah.
So most of your work is the neck, the spine, the back, like you said, pain management type stuff.
Correct.
And so I guess a lot of those patients you see when you ask them of their history or find out their history, is it a lot of sports injuries?
Oh, a lot.
Throughout that led up to that point?
Yeah. The guys, the male patients that I see often will bring up old sports injuries. They're proud of them,
Oh, yeah.
And I think we all are. Certainly back in the 70s and 80s, you think about how we didn't know as much about preventing injuries as we do today. and certainly how to have the body recoup and heal. And so, we're really blessed with the information and data we have now to be able to keep kids on the sideline and be able to play the game they love for longer, hopefully.
Yeah.
So question. So we're talking about neck, back, or spine. What's I guess a common injury that you see dealing with those, the neck, back, or spine?
Yeah, specifically in football and soccer and some of those other pretty physical sports. There's a radiology term, pars defect. It's where the spine sometimes will have a defect in it where there's not a connection to the vertebra that it should be. And you may have been born with it and you wouldn't even know. So that's something that we do pick up on athletes from time to time. Scoliosis, is something that they may not know that they had before, and then we'll pick that up. But the acute whiplash injuries and the hits that sometimes come with athletics, we'll see that on X-ray and be able to treat it like we need to. Yeah.
And back up real quick. I didn't want to cut off with his question, but you were talking about sports injuries and telling stories and how men are proud.
Oh, yeah.
You told me before the show about your injury. You want to say anything about that?
Yeah. So I played at Cisco Junior College, and we were playing Ranger Junior College, if you know that school, and it was in Eastland, Texas, and we were in cover 2, if y'all know what cover 2 is, and they decided to do a draw to the running back, and we had our inside linebackers stunning, so the running back just split them, and like we're taught, break to the outside shoulder to your help. So I did that, and my help came for sure. And he racked my right arm right up against the other guy's helmet, and broke both bones in the forearm, and that ended my college career.
How many games in the season was that?
That was game 1, actually.
Oh man,
That's right.
Yeah, that's hard. That's a hard way to go.
That's
out.
not that's one that you probably wanted to relive.
But I made the tackle.
Hey,
that's the most important part.
And he didn't get up quickly.
Listen to Dr. Ohman breaking down the defense, cover 2, splitting the. Man, I love it.
So I guess since knowing that you're a neck, back, and spine guy, just some I've experienced, not myself, but of course I've experienced a friend who in a state, don't say nothing, Jeff, but in our state championship playoff game, Corey, he ended up making a what I would say, and nowadays we call them bonehead decisions, where he came down with his head down, and he ended up being paralyzed. How many times or how often do you have injuries come in where I hate to say it, but God was on their side? It could have easily went the other direction, but maybe not was as serious as being paralyzed, but caused a severe injury where things had to be done to be able to make sure that maybe they didn't get to play sports anymore, but still had a way of life.
Yeah, there's been a few athletes through my career that we've had to clear and document more than you would normally, just to make sure everything was appropriate. I've had maybe one or two, probably two, spinal injuries that they were initially had some paralysis, but it came back on the field. And there's certainly protocols and policies that we go by to make sure they're okay before we put them back on the field.
Okay, so what causes those type of injuries? So if we can kind of dig a little bit deeper, what causes those type of injuries?
Well, there's a couple of ways. Certainly with the neck down when you're tackling, but it can be any kind of force that is to the extreme, especially in the neck and low back, flexion or extension that puts enough pressure on the spinal cord to cause spinal shock. And that's basically like turning off a computer. It can reboot, and you hope it does. And unfortunately, the ones I've seen have. but we do go through several visits talking, more of a counselor more than anything. Hey, do you have a real love for this game? Do you see yourself going to college? Is it worth the risk? And, that's the conversations you bring in family and say, look, this is reality. You're 5'8" and 162 pounds. You probably don't need to be playing defensive end. Now, can you anatomically and you're good to go? Yeah, you can. But once you have that spinal shock injury, you really want to be careful with that.
So you're more susceptible once you have that initial injury to a re-injury.
If you rehab it well enough, I don't know the data on if you have an increased risk for another spinal shock. I would think you would, but the fact that you've had it and now you're playing with that in your mind, that's a hard thing to want to put a hat on somebody when you've had that done before. It's like boxers that find out they got a glass chin. It's never the same, So, and that's when we talk about, hey, what other sports do you like? Do you like baseball better than football? Well, dadgum, let's get you into baseball and do the thing, But that's not always the case, and certainly football is the more aggressive, physically demanding as far as bodies being hit, and so those are the conversations you got to have.
So another question I had along those lines, what type of, is it just all collision, or could there be other things that cause these type of injuries, maybe repetition or doing things like that?
Sure, yeah. I would tell you that a big part of injury is weight training. Bad form or too much weight, not letting your body really heal from previous injuries or just weightlifting in general. It can cause some back issues and neck issues. Sure, that's why it's important to make sure your strength coaches are well educated and if you're noticing something, don't. Back when I was playing, you didn't gripe too much,
Shut up and play.
Yeah. Shut up and lift the weight.
Yeah.
And it shouldn't be like that. It should be, hey, if something's going on, let's catch it before it gets bad, so we can fix it.
Do you have or know of like any? I guess, like for me, always like when I had an injury or I have something that happens like for the first time, I'm like, well, I don't know what's going on. What are some of the things that I guess, I don't know, like what would somebody feel if they had a pinched nerve or, some kind of chronic thing that's starting up? Like what, is there anything that, that you say like, hey, if you start feeling this or feel that right, to be concerned? Yeah.
I mean, we used to say, everybody plays with pain, and that's true to an extent, bruises and bumps and that kind of thing. But when you notice dysfunction, meaning if you can't move a certain way that you could have before, or weakness, electrical shooting pain, those are all things that shouldn't be. And so when an athlete has that, they notice it because they're all about increased vertical jump, increase or decrease in their 40 time, or their bench press is going up. They notice when something's going on. Now, will they say anything about it? That's another question. But that's why it's good to get things before they get bad.
Yeah. So basically, any type of limitations.
Yeah. I mean, if it's an acute thing where, man, my hamstring's a little tight today, well, maybe it's good not to do deadlifts today. Maybe we need to just do some body weight stuff and see how your muscles react to it. That doesn't make you a punk,
A wuss.
A wuss. It's listening to your body, because you want to be able to be good to go on game day. Points are not scored doing deadlifts. Points are scored on the field. So you want make sure you're ready and good to go at that time. And if that means, hey, I don't do this set of deadlifts, and see your athletic trainer about it, so be it. You gotta get ready for game day. So
For sure. So I guess let's take a quick break here, get a word from our sponsor, and then we'll be right back with Dr. Ohman talk more football.
At Orthopedics Express, our primary focus is delivering exceptional care to patients with orthopedic injuries, such as sprains, strains, broken bones, and joint pain. You'll receive the expert care you need when you need it most. Simply walk in or schedule an appointment through MyChart. Located inside the Center for Advanced Orthopedics, Orthopedics Express is your fast track to orthopedic care.
All right. We're back with United Regional's own Dr. Ohman. Thanks again to our sponsors. And let's get back right into it. Let's talk about some, first thing, I got a question. Are you ever on the sideline? I know you said you take appointments by appointment only, so you probably progressed past that point, but do you still see some sideline time, go out there and watch some games or anything?
I've done it since residency. I tried to cover the Odessa Panthers, the different schools there in Odessa when I was in residency, and you try to do those things to show that you're really interested in the sports medicine fellowship, and put that on your resume, and do the different athletics, not just football. But I've done sideline work. I haven't in a couple of years, just because there's doctors that are designated for that, but I do still fill in from time to time. Yeah.
Very cool.
Yeah. It's interesting. I had in fellowship, just you got to be ready for any injury, and it's not just the athletes. So in fellowship, I had an athletic trainer come up to me and say, "Hey, will you take a look at my coach?" One of the coaches there when I was in fellowship, and he said, "Yeah, my fingers are numb." And I said, "Well, did an athlete hit you in the elbow or something and it's causing some numbness?" And he said, No, I don't know what the deal is." And I said, "Well, let's go over here," and we do an exam on him, and his blood pressure was crazy. It was like 160 over 120. I mean, it was just strange. And got into the history of some diabetes, hypertension, those things. And this coach was quite vocal on the sideline. He made his opinion known very, very clearly. And so we brought him back to the ambulance just to monitor him a little bit. And the EMS guy the EMT that was there, he says, "Hey, he's starting to have some weakness in that hand." And I said, "Oh no," because I knew I was about to have to tell this coach he's going to have to go to the ER because he was having a stroke.
Huh.
And so after multiple minutes of convincing him, "Hey, this is a real thing.
This is a little more important than your football game.
You
right
got to go. Okay, we can't have you out here. I can't do nothing for you. I don't have any clot buster or anything to do." Not that I'd even do it if I had it, but finally got him on the gurney. He said, "All right, we're going to get you out." We had another rig coming to replace it. And he, out of the corner of his eye, he saw something he didn't like on the field. And if he doesn't jump off that gurney and run toward the field, and I like to tackle him, and I finally got him wrestled back in the ambulance. And sure enough, he got to the ER and couldn't feel half his body. And thank God that the ER doc was there and the neurologist was ready for him, and they busted that clot up and got him back pretty quick. So
that's amazing.
Got to be ready.
Yeah, that for sure. He actually got off that gurney, and
coaches are crazy, man. Coaches are crazy.
He's locked
They're
in.
very passionate. Very passionate.
I'm telling you.
Put a lot of work in, a lot of hours. So
Yeah.
I get it. I get it. It came from a good place.
Yeah. Huh. So let's move on to sorry. Let's talk about some prevention tips. What are some of the things that you would recommend, or what are some of the prevention tips to, I guess, avoid having to go see Dr. Ohman?
Yeah. Well, it's sport specific, right? So, one thing we see in basketball, especially females, they're very, very high risk for ACL rupture, and it has to do with the anatomy of the knee and the hips and how they land when they jump. And so, the ruptures can be just from jumping and landing. It's not like they get hit from the side like football. You think about a helmet getting hit to the side of the knee goes in. No, this could just be them, landing. And so there's different preventative exercises that they can do on a regular basis that help strengthen certain muscles, that helps to support those ligaments in that joint. As far as football, we think about neck strength, really making sure your neck is well trained to take some of that impact. Ankles are bad in football. I don't know if I know anybody that hadn't had a rolled ankle before in football if you played long enough. And certainly the concussions, and that's where we talk about the teaching the right kind of tackling and technique. But baseball players, you have especially pitchers and catchers that are throwing multiple, dozens and dozens of high speed throws. Different banding type of exercises they need to strengthen those muscles. So there's definitely different sports have different areas of preventative exercise. But there's plenty of that, and better data that we have now to teach kids how to do that.
Yeah, and so you kind of touched on strength and conditioning coaches. I think that's a growing thing. We've talked to multiple of our coaches when we did our football preview, but how important do you think strength, like having someone designated or designated strength and conditioning coach for your program or for your school, like, do you think that would be, do you foresee that as something that will probably end up being very, where every school has one of those, or would you recommend, hey, go get a strength and conditioning coach? I mean, because it seems like those guys are helping out a lot.
Oh, yeah. Yeah. And I think most schools do have a designated coach that does some extra training, just like we have to have CME hours every year. The coaches do go through some training that's sport specific for strength and conditioning. It is good to have one person that really, spearheads that. That way they can, because there's a lot of responsibilities for all the coaches.
Yeah.
And so having one coach that kind of understands that aspect and is educated in it and can come up with protocols would be a great asset, I think.
Yeah.
So let's talk a little bit about prevention. So what are some prevention some things to help prevent, like maybe back, neck, and spinal injuries? What are some things that you could do from a preventive standpoint?
Yeah, we talked about weightlifting before, and certainly the low back exercises that deal with squatting and deadlift and all that. That's going to strengthen the back certainly, but it can hurt it too. So good technique, like I said before, is really paramount. The neck, we used to, I don't know if y'all did, but even when we were stretching at the very first part of practice, we would have a time where you got down on all fours and you put your head against somebody's knee and you push, and you do the other side and you do it from front to back, and that does help get the muscles stronger. But even past that, even in the weight room, in off season, it would be important for that to happen too.
So stretching and I think you mentioned earlier, like allowing your body to heal as well. Like don't overdo it. Just because, at some point, if you feel some kind of weakness, like It's not like you said back in the day, like you just push through it.
Right.
Like if you feel something that's weird or odd,
Yeah.
tell your coach, tell whoever, tell your trainer, hey, and then rest.
Yeah, and most injuries are not, surgical injuries. They're overuse injuries, right?
Yeah.
And so with our athletes, like in softball, volleyball, that play year round with different
Travel teams,
and that kind of
AAU.
thing. Man, it's really important to count pitch count, and the overuse injuries are way higher than any ACL tears or something traumatic like that. So if you can prevent those from happening, you're doing good.
So I'm gonna ask you this on the air because
Yeah.
a lot of the softball dads, probably coaches, are not gonna like that I asked this question, but for years I've asked this question. I get the same answer. Of course, me being a male, I'm really probably in the last, I say probably like the last 2 or 3 years, I've really gotten into softball. It's a great sport to watch. I enjoy watching it. The girls, I love the chants. I'll catch myself doing the chant sometimes.
Mm-hmm.
But you hear it all the time that it doesn't matter how many pitches that a softball pitcher throws because of the way. Males, they say it's an overhand, but because it's underhand, they say it's more of a natural movement, so it doesn't matter. And I always like, what do you mean? It's still, that's a lot of.
It's not natural for them to throw their arm around in that
Right.
circle
Yeah.
for 700 times.
But you hear it all the time. You don't really see a lot of softball pitchers being put. I've been in countless games where girls throw 100 plus or more pitches.
There's
in
not a
game.
pitch count on them.
So,
Have you heard that, or do you have any experience
No,
with that?
I'd have to look at the. I'm sure there is a pitch count of some sort, but my point is, it's not just the rotator cuff, it's not just the elbow. It's if you see a softball player, pitcher, come off the mound. I mean, every time that they push with that hip, I mean that's a lot of force right there. That's your strongest muscle, the gluteal muscle, the buttock muscle, is your except for. Actually, your tongue. Your tongue is by surface area the strongest muscle. But yeah, no, that's right.
I'm about to go home with that one.
Dang.
That's right.
I'm like, what's the
That's
strongest? I'm about to
That's
hit
right.
what's the strongest muscle?
I'm sure we'll get some comments about that. I don't know if I want to see them, but the gluteal muscle is the strongest muscle, and so if you're putting that much force into that joint, into that muscle, you're going to get some overuse injuries. So. Is it as demanding on the elbow, shoulder as baseball? Probably not, with good technique, but still something that you'd want to get some feedback on. Yeah.
And the reason I ask that is because you'll see, especially in the playoffs and stuff, you'll see a girl pitch on a Monday, and she'll turn right back around. She's pitching Tuesday.
Mm-hmm.
Where in baseball, that's ultimate no. You don't do that. Like
Yeah.
if your ace pitches on Monday, you might not see him for 3 to 4 days,
Mm-hmm.
and that's if it's on short rest. So,
Right.
but I've seen softball pitchers pitch an entire tournament. I've seen them pitch every day, and I always like, don't they need some rest? And I was like, it doesn't. And I think more people are focused more on the arm. But what you said was key because
Yeah.
I've seen a lot of girls have those hip injuries.
Yeah.
Because
hip flexor injuries are real big. I mean, it may not be as often, like I said, in baseball, but I've seen girl pitchers in the physical therapy room because of those overuse injuries. So it's something you got to monitor and look.
I've heard that too, where they say, "Oh, it's such a more natural," but
I don't see how
there's
it's
still
natural.
kids that they still get shoulder injuries. I mean, we had one of our best pitchers in the whole area last year sit out more than half the season because of a shoulder injury. So they're still happening.
Yeah.
What are some of the most common minor injuries, and then what is some of the treatment, and even go into, I guess, more detail of how when you send them home and say, all right, you need to do this and this and this, like what kind of the
Right.
home treatment do they do?
Yeah. So soft tissue injuries are usually the minor injuries that we see, hamstrings and strained muscles in different joint areas. And usually what I like to do, at least, is you gotta rest it. You gotta let the body do its thing. Okay. We're real quick to send to physical therapy, and if we send them too early and the muscle is hot, okay, they're still having pain, and it's within 72 hours of the injury, the physical therapist is going to be like, okay, we need to cool this down. We don't need to do a lot of muscle work on this area. We need to let the body do its thing, cool it down, rest. And then as it progresses over that, after 72 hours, you get to the 4th, 5th day, you can start doing some light stretching and some different modalities that physical therapists do. But initially, at least in my philosophy, when you roll an ankle, you don't put a heating pad on it.
Yeah.
You put ice, right? And that's what I go by, and I try to tell patients, look, you gotta. If I don't like patients on NSAIDs very much, ibuprofen, Advil, those type of things, for very long, because there's different things that those cause kidney issues and stomach issues and that kind of thing. You need to let the body do its thing, and maybe that's my chiropractic philosophy coming back in me. But I've seen success when the athlete will rest it and ice, and then start to progress slowly into therapy. Now, it depends on the injury and the sport, but if they're good to go, they can go. But anytime I am struggling with, hey, is this athlete ready to go? Can they protect themselves? Do they have normal range of motion? If they still have some pain, well, we all play with pain, but can you protect yourself? And by doing those initial things well, usually we can get them back on the field pretty quick.
Yeah, you mentioned, can you protect yourself? That's something I think that multiple of our guests from United Regional in the sports, have mentioned, like, right. Can you protect yourself? Are you able to do this? Are you able to do that? So that's pretty good. What about, I think you just mentioned it, like returning to play, kind of, what do you, I guess you got like a protocol or a checklist or something, depending on whichever injury it is, but what will allow a player to return to play? Say you said that ankles are, so everybody has a rolled ankle, which has held out one of our top running backs in the area for a couple weeks now. Like, what, depending on, I guess, the severity of the ankle, this or that, but so what would constitute return to play for him?
Yeah, if you have a grade 1 sprain, which is the lowest grade we have, typically it's, again, getting the swelling down, making sure there's no fracture. If they can put pressure on their foot, usually there's no fracture. But if they really cannot even put pressure on the joint, then we got to get an X-ray to make sure. But past that, the ice, the swelling going down, and then you make sure that they have normal range of motion. If there's a little pain, that's okay, but if they can go through the full range of motion and not be hesitant on it, in general, that shows us they're in a good spot to be able to, do those athletic type motions, right? Athletics is a dynamic sport. You're not just running straight ahead. You're running sideways. You're twisting. You're turning. So, and our athletic trainers are great in the schools and at MSU, and they're good at watching a player, because they see these athletes every day and they know their capabilities. So if they're able to see them act the way they should act, right, they're probably good to go. If they're not, they know.
Okay, so you mentioned the trainer, and let's kind of, I guess, full circle here, because they whenever we had the trainers in here would mention the doctors, and so you're the signing off. You're the final to say, okay, he's good to return back to full practice or back to full play, he or she. Describe or tell us a little bit about how important the trainer is for you. Like you just mentioned, like if the trainer says this or the trainer says that. So how important is that relationship between you and the trainers?
Oh, it's huge. It's huge because there are eyes on the field. You know, we can't be out there all the time at practice and even at games. We have very well educated athletic trainers that are taking care of these athletes, and the communication's key. All the athletic trainers have access to my phone. They can text me at any time, and we text back and forth if there's any issues. But we do we rely on their evaluation of the athlete, and that's why I say, look, you know, and you know, I won't let you, but you can scroll through my phone and see that, hey, if their dynamics are good and they're tolerating 100% play, you know, let's let them go, and I trust their judgment.
So on that, returning to play, so how hard is it when you maybe dealing with a kid that's a senior in high school or something, and it's just not feasible for him to be able to play that year, but, you know, maybe he could long term, maybe down the line, but that particular year it was a no-go. How hard is it for you to sometimes break that news to those players? It's like, hey, I'm not saying
parents,
hey, I'm not saying you can't play, but there's not enough time left in this football season or whatever sport for you to be able to continue to compete.
Right. I don't start off by saying that to them. I don't say, hey, you can't play. I say, here's what we got. Okay. Right? Here's what we got. Here, you have this injury. It's this severe. I try to keep emotion out of that conversation and just stick to the facts. You know, your range of motion is this. Your strength is that. You can't tolerate this motion. You know, at this point where we're at today, you're gonna have a hard time playing at your full capability, and we know that you want to play. Now, if that changes, then we can reconsider what we're gonna do. You know, but at this time, you want to be 100% for your team, right? And I think you come at it from the team aspect, and parents for the most part are on board with that too. They want to make sure that their child is not going to get hurt even more, right? And so when I've had to have that conversation, it goes that way. Is stick to the facts, and most times, even though it's hard to accept, the athlete usually understands why. And when you don't explain why to somebody that has put that much time into the sport that they love, that's when things get frustrating, you know. So I tore my ACL my junior year playing against West Orange Stark, and we beat them that year, by the way. And they were a powerhouse back in the 90s.
Man, I don't know. I really don't know what happened to why they're not still.
Yeah. Well, Dan Hooks was a coach out there at the time, and
they were breeding them.
I'm not going to say he recruited,
but he recruited.
I said they were breeding.
But
he's not going to say.
I will say this, that they had athletes from other teams that seemed to have family members get jobs in the district from time to time. Should I say that? I don't know.
Yeah.
Might want to scrub that one. No, that's back in the day though. But all those towns kind of mixed in between each other too. So you know.
So it's still happening.
So the one thing that I've noticed, I'm happy that you answered the question the way you answered it, is because United Regionals. This is a plug to you guys. You guys, the staff, the way that you guys approach things is great. It's never in a negative, but it's always in a positive, and how you redirected and turned the negative into a positive situation. You said it. I think everybody that's been, I've kind of asked this question. It's kind of been like a question to ask to just see how everybody responds, and it's kind of the same thing. It's one of those things where we're not going to allow it to be a negative. We're gonna make sure that we turn this into something positive, and for the kid to feel better about themselves moving into the future. So I like your response on that for sure.
Yeah, and even if it's let's just say it's football and it's an ACL, and they're a dual or a 3-sport athlete, some of those sports are later on in the year, and there's a chance you rehab that knee and can get back for baseball or whatever the sport may be. So you want to motivate in the right way. You certainly don't want to lie to the athlete, but you want to give encouragement when you can, I think.
For sure.
Sure. All right, so I think that pretty much covers all the stuff that I know we needed to touch. Do you have anything that you want to talk about? I mean, you watch NFL football? Or are you more a college guy?
I'm more of a college guy. Yeah.
Oh,
So
yeah, you said Alabama.
I got some pretty strong opinions on the portal. If you want to hear about
Let's
it.
get it.
Yeah.
Let's go. What do you think?
Yeah, I'm listening.
Because we talk about it a lot.
Do you? Okay. And let's see what y'all think about this. So, certainly the portal has made any team can beat any team on any Saturday. Vanderbilt, right?
It'd be
Beat Alabama.
Yeah, I don't know if you know that or not, but
I did know that. Roll Tide. And
they didn't roll that night, did they?
No, they did not. But you know what? I saw it coming.
Really?
Oh yeah. How Vanderbilt played Missouri a couple weeks before. I said, you watch Vanderbilt's going to get somebody, and they sure did. And I think you're going to see more of that. I think you're going to see athletes like we were talking before that are on the second, third string get opportunity to play in a system that is better suited for them, and they're going to be able to show out. And I think that's a good thing. Back when I played, and before the portal was a thing, you could get a coach one year come into your living room and say, hey, we want you here. I'm going to take care of your child. I'm going to, this is what we're going to do for him or her. And the next season they're not there. So the coach has a portal, right? The coach could leave at any time. Well, you just put yourself out there for 4 years, and the coach came in and said, hey, I'm going to take care of things, and then they're not there. So I always thought that was kind of squirrely, Now,
now they just go with them.
Well, that too, but the portal's got to a point where, you're at one, as I understand it, you're at one school for 4 games, and then you're not getting the playing time you want, and then you can jump ship and go to another school. Not the same season, I believe that's right, but if there was a little bit of limitation on the portal system, say you got to stay 18 months at a school or some time limit, I think that would have some better continuity, because the coach, they put a team together and they think, okay, this is who we have, and then they don't. That's tough continuity. That's tough for being able to scheme your offense or your defense based on the players you have. So I see it as a good thing. I think it's good for the audience of good football playing, where teams have good access to good players and they're not just riding the pine. But it's certainly tougher on coaches and understanding that. And certainly the NIL is a whole different subject.
Yeah.
I don't know how much money I could get back from Cisco Junior College.
Yeah. So I'll say something about what you mentioned, 18 months. I could get on board with that. I don't know about 18 months. I would say 2 years.
I'm not on. I don't support that.
Make it be 2 years, so then they have to,
or so many games
ride it out and see, or
Only reason I don't support that is because for years, kind of like you're saying, I guess I'm the old school to that. For years, coaches can leave whenever they want to.
Mm-hmm.
The thing about it is the commitment of let's just be real. It's a sales pitch. A coach will tell you whatever he has to tell you to make sure he gets you, and another school don't get you.
So then let's just put a we'll put a clause in there that if that coach leaves, the players he was part of recruiting are now eligible to leave with him.
But I think even the coaches that recruit you don't necessarily – you're just a part of a recruiting class. You're immeasurable when you get there. If you're not with – because they don't really know who you are until you get to their facility.
And that's true.
Everybody looks good in the system that they played in 4 years that was catered to them. But once you get to that university, I tell everybody, if you come from little bitty Nocona, Texas as a 5-star athlete, once you get to Alabama, there's 1,000 of you. Like, so it's just
you're
level.
a 2-star.
So like it just happens. Like, so what I would say is I agree with you. I do not think the portal should just be you jump in whenever you feel and leave and don't want to compete, because that to me that's my biggest thing. I don't think everybody's wanting to compete. They're just wanting the easy way. But what I think should happen is if we get a kid in, he goes through, he red shirts, go through spring ball, and he's kind of seeing that he's falling behind on the depth chart. Because what happens is whenever they recruit, they don't. So say if you're third on the depth chart going into spring ball, you try to, to move up the depth chart. Well, I'm just be honest with you. That freshman class is coming in the next year. You're already further behind on the depth chart because they're looking to replace the third person, at least the third person on the depth chart. So what happens is every recruiting class continues to get better, continues to grow. Alabama has, and for years I used them as an example. Before this transfer portal, Bama set with, if they had 53 kids on the roster, 45 of them were 5-stars. But they were there. Like, it was.
Yeah, the portal definitely took away from the powerhouse.
They would have 5, if not 6 running backs that could play anywhere at
5-star. And what happens is those kids sit there, they never get an opportunity. Mm-hmm. You never know. But I tell everybody,
look at Jalen Hurt.
You are getting your schooling paid for, so let's just be honest. You're benefiting somewhat. But something that I think a lot of you know this because you play collegiate. Scholarships are not. There's no such thing as a full ride. I'll say it. Scholarships are earned year to year. You have to. A coach could come to you at the end of semester, after your year that you signed for that contract. You sign a letter of intent every single year of college. You're re-signing back up. It's a contract every single year. If you don't meet the standards of doing what, they can just let you go at any time. So I think what NIL, the point of the transfer portal was if these universities have that much opportunity to move on, give these kids an opportunity to be able to do the same thing. Do I think that it's getting out of control? Yes.
That's NIL. NIL's
NIL.
No, I'm talking about the transfer portal. But I think it's getting out of control.
That's why I say 18 months. So if you red shirt, okay,
a year and 6 months.
So the 18 months would mean from the
2
start
seasons.
of the first semester, that first season, if we're talking about football, all the way around through spring training, and then that second sophomore year. If you're redshirted, it's still kind of your sophomore year, but freshman as athlete, as being on the chart, and you're not happy, then that's fine. But because
you still have 3 years of eligibility,
right, and you're going to a new environment.
2 seasons, basically.
You're young, you're emotional.
Really not.
You don't understand the system of all the nuances that go into that, and you want to play. It would be good to have a little bit of patience with that, I think.
Yeah.
I think as a sophomore, if you're not playing like where you want at that January semester, go to the portal, go into a different workout scheme, a different scheme.
Get into their spring training. Over.
That's
fine.
Would we hold the universities to that agreement as well? So what I'm getting at, I agree with you on that. That makes a bunch of sense to make the kids earn their worth. But do we hold the universities to the same standards of you're not able to release a kid? You have to have them for at least 18 months. Because
are you saying about whenever they sign their letter of intent?
Because after the first
their
year,
initial one is for 18 months.
Versus
the
for 1 year.
I think that's a. I actually think the schools would rather that because you get continuity with players, you get to grow the player, and it gives them some intentional vision of where this athlete should be and shouldn't be. And that gives the athlete time to understand that too.
Builds a relationship.
Absolutely.
Yeah, I agree with that. If we can get the schools, maybe somebody will see this. I think we got a good
The
fix.
big O, Dr. O
I'm just saying, y'all.
combo.
Sign me up.
So, hey, real quick, before we get to, because we could talk all day.
Oh, yeah.
I do want to talk about this, though.
Yeah.
What's your I guess your thought on the 12-team playoff? First of all, what was your thought when it went to 4-team playoff, and then now it's expanded to 12? Because a lot of people who are huge college fans have a very strong opinion on this. So.
Yeah. My opinion will be we'll see. So we'll see what this looks like at the end of the year. But I will tell you just from the spectator aspect, I love seeing competitive football be played. You won't, and even though I'm an Alabama fan, I can appreciate when I heard Vanderbilt beat them. I was like, there you go, Vanderbilt, let's go.
Yeah.
I was happy for them. I really was, because for so many years it was just the same old teams doing the same old thing, and I think it's a good thing. Going back to last year, the big controversy with Florida State and not being able to get in, all that. I understand where people were coming from that, and I don't want to get too harsh about that. But your quarterback goes down. You're not the number 4 team.
Yeah.
And you can say what you want with how they played, and they got tore up in the bowl they went into, and they were let down not being in the playoffs. But I think the 12 team, there'll be less
blowouts,
controversy about who's the 13th team, right?
True.
Than it will be when it's the 4th team, right? So I think some of those things that, hey, yes, it's the whole team that gets to the playoffs. It's not just the quarterback. It's not just the defensive end. It's everybody, and being able to reward that team, even when somebody big goes down, if they have the totality of their work and they're worth the first top 12 teams, I think that would be better to reward the teams that do that.
Yeah, and I think you touched on it with being more competitive. You said you like competitive games.
Absolutely.
So you're not going to have the huge blowouts that you have in the semifinal rounds of just the 4 teams.
No, I don't think you are.
So that, like you said, is going to make for a few more weeks of more competitive games. You may still have, once it gets down to the semifinal, there may still be blowouts because you're still going to have only, 3 or 4 extremely powerful teams.
Well, I think you're going to probably have.
It's going to be better than what people think.
I think so, too. I hope so.
I think you're going to have a 3-loss team in the top 12.
Yeah, I think you will.
Because,
2 loss for sure. There's going to be multiple 2-loss teams. But
you watch number 12 be a 3-loss team. You watch. I bet it'll happen. Because everybody's tearing everybody up. Georgia got 2 losses now?
They got 3 losses.
Did they get 3?
They lost to Alabama and then lost back to back.
Georgia ended up. They got 2 right now. Georgia.
Yeah.
I thought they lost.
They pulled it out. They
did. They came.
Tennessee was 17-17, and then they were able to. They put it on them the second half.
That's right.
Okay.
But they were saying that I think Georgia still has one more tough opponent that they could end up being a 3-loss team. That I'm saying it on the air. I don't care what anybody say. Yes, Texas is in the SEC now, so I get it. But we got to let that SEC stuff go. It will eventually. It's not top to bottom like
because of the transfer portal. That's what's going to make it go.
Well, that's what I'm saying.
Strength and they're in the SEC. Like
all the
you got Big 12 teams, you got Pac-10 team. You got not Pac-10, Big 10 teams that are playing just as good as the SEC. And once that transfer portal keeps, like you mentioned, you got that kid from Vanderbilt. Did he come from the portal, the quarterback? Or he just came? It was just his time up. I don't know either. But
I don't know that.
The portal had to do something with that Vanderbilt team.
What was it last year where Liberty was so big, right? Yeah. Liberty University, and they got tore up pretty good. And now you might have that based on the rules of how they put people in the top 12 with their conference championship and all that kind of stuff. So
gonna be interesting how they do with Ohio State and what's the other team over there that's doing good?
You talking about Notre Dame or
Oregon? Ain't Oregon in there? In Ohio State? In the
is Notre Dame in a conference?
No, they're still.
No,
They're still in by
independent.
themselves, huh? Yeah.
But I think,
Did Oregon go to Big Ten?
I think they went to the Big
I
Ten.
think they
too.
did, and Washington, and
So that's what I'm saying. Think about Oregon and Ohio State. They could try to mess one of them over if they,
No,
they're
they
going to
both
face
go.
each other in the Big Ten championship most likely.
they'll still go. They'll just get a lower seed.
It just depends. I mean, you never know what these.
Are they
people
only
gonna do.
one-loss teams though?
Well, that's the thing. These big schools.
They're going to put the SEC teams.
There's a lot-
That's what I'm saying.
There's a lot of money in it, and
They're big name schools.
I think you're going to get a 3-loss team in. I don't know. We'll see.
He's calling it.
We'll see.
The Dr. Ohman prediction.
We'll see.
I like.
Yes,
we might
sir.
have to get him on the channel some more. We might have to
Yeah,
get
talk
some
sports.
regular
Oh, I
sports.
love it. I
Talks
love it.
with Dr. O.
I love
That's
it.
what
Yeah,
we gonna
I love
call
it.
But hey, like I said, we could play. I mean, we could talk about sports all day. I know that we need to cut this episode a little bit longer than normal, probably, but that's okay. We had great company. Dr. Ohman, do you have anything else? Do you want to say anything or have anything else for us? Or?
Yeah, just as far as your athletes, man, just from the parents' perspective, just make sure that they're talking to you about things and about their injuries, and if there's something that's slowing them up, just be honest with it, and let's treat it before it gets real bad. That's the last thing you want is something to be nagging, and they carry it through the season. There's things that we can do preventatively, but also acutely if something's going wrong. From the parents' perspective, it'd be good to make sure you're communicating with your kids.
Very good. Very good.
Yeah. And your athletic trainers, of course.
Yeah. Well, Dr. O, we appreciate you coming on. Oh, I said
Absolutely.
Dr. O. Sorry, Dr.
No, that's
Ohman.
fine, man.
We appreciate you coming on. And
Appreciate
yeah, it was a good chat.
Yeah.
And I guess we'll see you next time.
Honored to be here. Thanks
Appreciate
so
it.
much.
Yes, sir. Take care.